Hi, my name is Francie Bernier. You are probably watching this tape because you have a problem with bladder control. I am a nurse who has treated hundreds of patients for urinary incontinence or bladder control problems. I am here to tell you how you can regain control of your bladder and your life. First, you should know that if you have incontinence problems, you are not alone. More than 20 million people in the United States have bladder control problems, and more than half never speak with their doctor about it. There are some common misconceptions about urinary incontinence. Some people think urinary incontinence is a normal part of getting older. Not true. The fact is, urinary incontinence is often a sign of another medical problem or condition, and many people are too embarrassed to discuss it with their doctor. If you are watching this tape, it means you have overcome the fear of embarrassment. Congratulations! This is the first step to taking control and gaining freedom from so many trips to the bathroom or having to use special pads. Some people think urinary incontinence cannot be cured, or it can only be cured by surgery. Surgery is one treatment for incontinence, but it has limitations, including a hospital stay, a recovery period, and a much higher cost. Medications are another option, but most have unpleasant side effects. There is another choice, a non-surgical approach called pelvic floor therapy. This program focuses on behavioral modification improvement to the nerve function of the bladder and the strengthening of the muscles that support the bladder. Studies show that these programs produce significant improvement in the symptoms and quality of life for people who suffer from urinary incontinence. Your doctor has recommended that you begin this program. Before we talk about what you can expect, here's a little background on the most common types of urinary incontinence. There are two common types of incontinence, urge and stress. With urge incontinence, people have a frequent and urgent need to use the bathroom. These are the people who know where all the bathrooms are in the malls, restaurants, and theaters. Sometimes people with urge incontinence find it closely tied to a specific event, such as putting the key into the door or turning on the water faucet. The cause of urge incontinence is unknown, but we do know that symptoms happen when the bladder goes into a spasm. People who suffer from stress incontinence will have symptoms when they are doing activities such as tennis, running, jumping, or laughing. In severe cases, just walking across the floor can trigger the loss of urine. Sadly, people who suffer from stress incontinence stay away from the activities that trigger their symptoms. That means they don't exercise, play with their children or grandchildren, or enjoy the highest possible quality of life. People can enjoy a quality of life with the benefits of pelvic floor therapy. Pelvic floor therapy is recommended as the first-line treatment for incontinence by the Agency for Healthcare Policy and Research, a division of the U.S. Public Health Service. First, why is it called pelvic floor therapy? The words pelvic floor are used to refer to the muscles at the base of the bladder that control bladder function. People who suffer from incontinence often have pelvic floor muscles and nerves that have become damaged or weakened for some reason. Pelvic floor therapy uses a variety of methods to retrain and strengthen the pelvic floor muscles. You will be taught correct muscle function and use so you can manage your bladder condition. Pelvic floor therapy is a complete program that calls for your cooperation and involvement, not just during your office sessions, but during the rest of your life as well. You may have heard of Kegel exercises, or even tried them. Kegels are an important part of pelvic floor therapy. However, most people don't do them correctly. Research shows that when done right, Kegel exercises strengthen the weakened muscles surrounding the bladder and improve nerve function. As part of this complete approach, you will learn to isolate and contract the muscles that control your bladder. And you'll learn to understand your condition by keeping a bladder diary, making changes in your diet, and reviewing how your medications might be affecting your bladder. You can even use special equipment designed for use at home. Now for the specifics of pelvic floor therapy. After your doctor has referred you to the program, you will set up an appointment at the clinic. You may be asked to fill out some forms in advance or even keep a short diary of your current bladder habits. At your first meeting, your clinician will review your history and current medications. Your homework might be to keep track of your voiding or bathroom habits, urgency episodes, fluid intake, and incontinent episodes. This is valuable information for the physician and clinician, and it sets a base to document your improvement over the following weeks. You will learn how to make changes in your diet. You might be surprised at some of the common items such as caffeine, alcohol, spicy food, and sometimes even milk can irritate the bladder. Another procedure is to schedule your trips to the bathroom. That means you may be asked to empty your bladder at timed intervals. You will learn methods to suppress the urgency in between the scheduled trips to the bathroom. You might be prescribed medications to help you get started towards improvement. However, often these medications are eliminated or the dose lowered as your symptoms improve. Your clinician will give you instructions in correct Kegel exercises. I can't emphasize this enough. These exercises must be done correctly, or your symptoms will not improve, or may even get worse. To help you learn how to do these exercises correctly, you will be able to watch a monitor in the clinic that shows you how you are using your muscles. There are other types of exercises to help stop the symptoms you are experiencing. Your clinician will outline an exercise plan that stops the urgency and urine loss associated with urgent continence. If you suffer from stress incontinence, you will learn specific exercises to perform just as you begin those activities that trigger urine loss, like when you sneeze or laugh. Believe it or not, you will someday do these exercises automatically, without even thinking about it. Each time you visit the clinic, measurements of the pelvic floor muscle strength and muscle activity are taken. They are viewed on a video monitor near a laptop computer. You and your clinician will monitor changes in the muscle activity and muscle function. What if you cannot contract the pelvic floor muscle to perform Kegel exercises? Don't be alarmed. This is a very common situation. If your clinician sees that the muscle is not contracting correctly, electrical stimulation can help the muscle contract. As an added benefit, when a painless electrical stimulus is applied to the pelvic floor muscle, it provides a wake-up call to the many nerves and muscles of the lower urinary system. To deliver the electrical stimulus, a small sensor will be placed into the rectum or vaginal opening. A painless electrical stimulus will cause an involuntary muscle contraction, which gives you a slight pulling sensation in that area. Eventually, you may be asked to squeeze with a contracted muscle when the stimulus is on. There is an electrical stimulation unit designed for home use. You can discuss this possibility with your physician and clinician to see if it would fit your needs. The purpose of this video is to help you know what to expect when you start your pelvic floor therapy program, an effective program that has been proven to help many people regain control of their lives. But it's important to remember that it's not up to your clinician to improve your bladder control. It is up to you to make yourself better. It is important to come to the office at your appointed time and bring your bladder diary if you are requested to do so. Follow the time voiding plan you work out with your clinician. Make a personal commitment to do the pelvic floor exercises as directed. Modify your diet or fluid intake. You will be expected to do exercises as directed by your clinician and physician for your type of incontinence. You may have other types of exercises to suppress your symptoms. You will need as many as 8 visits to the continence center. Although all of these sessions do not have to be done weekly, it is important that the first 4 visits be on a weekly basis. There are some cautions to note. As with every intervention, some treatments or part of a treatment are not for everyone. For instance, if you use a pacemaker, the